Now coming to the seventh characters, you need to know whether there are so many alphabets that might be given like A, B, C, D, S and all that. So we will have to figure out all of that. Okay, let's move on. I'll explain all of those, the 7 characters. What is underdosing? Underdosing means same way, report the code for underdosing. Say a patient has developed a diabetic ketoacidosis because his insulin pump has not worked well, it has malfunctioned. So you'll have to report the code for underdosing, and the complication as complication, mechanical cause or whatever cause of failure, followed by the symptom which the patient has developed. Next, we will move on to other conventions that as we have, symbols conventions. See, in the ICD treatment, we have various symbols. Say for pediatric age, we have certain symbols. As a primary code, we have a certain symbol. So accordingly, you can, and gender also we have codes like male and female. So we have so much of codes, and anatomical illustrations are very much given. So if any anatomic question is being asked, don't panic. If cranial nerves is being asked, don't panic, just go to the anatomic section, that's ICD 10 cm. You can find the entire pictures, anatomical illustrations that are given. So if you are doubtful about any structure, you can very well go and see all these pictures and refer. And please don't waste much of your time into it. If they are asking about any particular artery or any particular vein or any anatomical structure you are not sure of, go and see in the anatomical diagrams